In this podcast episode featuring Dr. Nicholas Fabiano, a psychiatry resident, the discussion centers around the significant role of physical activity in combating depression. Dr. Fabiano highlights a common gap in the medical field. While many doctors acknowledge that exercise can alleviate depression, they often lack specific recommendations for patients. This results in vague advice that leaves patients feeling unsupported. Dr. Fabiano introduces his FIT protocol, which provides a structured approach to exercise, emphasizing frequency, intensity, type, and time. Dr. Fabiano explains the multifaceted benefits of exercise on both the brain and body. He categorizes these benefits into biological, psychological, and social aspects. Biologically, exercise increases levels of neurotransmitters such as serotonin, norepinephrine, and dopamine, which are crucial for mood regulation. Additionally, it boosts brain-derived neurotrophic factor, which supports neuroplasticity and cognitive function. Physically, regular exercise is associated with larger brain volumes, particularly in areas like the hippocampus, which is vital for memory and cognition. From a psychological perspective, exercise can enhance motivation and reduce stress. Many individuals experience a sense of accomplishment and improved mood after physical activity, which can create a positive feedback loop, encouraging further engagement. The social aspect of exercise is also significant, as group activities can foster connections and combat feelings of isolation, particularly in vulnerable populations. Dr. Fabiano addresses the barriers that physicians face when recommending exercise to patients. Many doctors, despite their good intentions, may assume that patients are not motivated to engage in physical activity, leading them to default to medication or therapy. This assumption can overlook the potential benefits of exercise, especially for those with mild to moderate depression. Dr. Fabiano emphasizes the importance of understanding each patient's unique situation and being open to discussing exercise as a viable treatment option. He also points out that the medical community often lacks comprehensive research on lifestyle interventions compared to pharmacological treatments. This discrepancy can lead to a skewed perception of the effectiveness of exercise versus medication. Dr. Fabiano advocates for a more integrated approach, where exercise is viewed as a first-line treatment alongside medication and therapy. The FIT protocol introduced by Dr. Fabiano serves as a practical guide for prescribing exercise. The acronym stands for frequency, intensity, type, and time. Frequency refers to how often an individual should exercise, with recommendations typically ranging from 3 to 5 sessions per week. Intensity is categorized into low, moderate, and vigorous levels, with higher intensity generally yielding greater antidepressant effects. The time component suggests aiming for 45 to 60 minutes per session, while type encompasses various forms of exercise, including aerobic, resistance training, and mind-body practices like yoga. Dr. Fabiano stresses that the most effective exercise is one that individuals enjoy and can sustain over time. He encourages healthcare providers to tailor recommendations to each patient's preferences and capabilities, rather than adhering strictly to optimal guidelines that may be discouraging. In addition to exercise, Dr. Fabiano discusses the potential benefits of creatine supplementation in relation to mental health. Creatine is often associated with physical performance, but emerging research suggests it may also have antidepressant effects. Studies indicate that creatine can enhance the efficacy of antidepressants and cognitive behavioral therapy, leading to faster and more significant improvements in mood. Dr. Fabiano explains the biological mechanisms behind creatine's effects, noting that it helps replenish ATP, adenosine triphosphate, levels in the brain, which can be depleted during periods of depression. He emphasizes the need for further research to explore the combined effects of creatine and exercise on mental health, as this could provide valuable insights into holistic treatment approaches. Throughout the conversation, Dr. Fabiano acknowledges the stigma surrounding mental health and the challenges individuals face when seeking help. He encourages listeners to be proactive in discussing exercise and lifestyle changes with their healthcare providers. For those who may not be healthcare professionals, he suggests fostering supportive environments where friends and family can engage in physical activities together, thereby lowering barriers to entry. Dr. Fabiano also highlights the importance of education in the medical community, advocating for training that emphasizes the integration of lifestyle interventions into mental health treatment. He believes that as more healthcare providers recognize the value of exercise and lifestyle changes, the overall approach to treating depression will improve.